Thank you, Jackie, for the warm introduction. Thank you to NIOSH and the organizers. I'm delighted to be here. There were tens of thousands of children who lived or attended school, depending upon how you define Lower Manhattan, on September 11th and in the weeks, the months that followed. And as Jackie described, there are some substantial gaps in our knowledge, thank you, with respect to what the effects of that early life exposure was and the implications now 10, 15 years later. In many cases, these are now young adults as well as adolescents. And I'd like to draw some emphasis in particular on two aspects where there are some gaps in our knowledge. And one is in the impact of the chemicals that were in the dust cloud and in the dust and the fires that went on in some cases for months after the disaster. We had a substantial amount of research already accumulated with time looking at the psychosocial effects or the mental health effects of World Trade Center related exposure, the trauma in these children. That's actually quite, maybe not optimally described, but quite well described. And as Jackie described, there have been studies in pregnant women and the children recently born showing effects. But it's the early life exposures in childhood where our knowledge is arguably the most thin. Now, the World Trade Center Health Registry, which Dr. Brackbill will describe in greater detail in a few minutes, documented the first warning signal in this regard, looking in particular at the development of asthma in children who were exposed to the disaster. And they found substantial, really frightening rates of asthma after 9/11 in the youngest children at the time of the disaster, that is children less than 5. We had the privilege of working with Dr. Reibman and colleagues, leveraging the clinically referred population of children who came for health concerns related to 9/11 at Bellevue, and found some interesting and unfortunately concerning findings supporting effects as well, potentially on lung function in the children who were exposed, but also with a clustering of cardiovascular related or heart health related risks. In particular, we found a relatively high rate of children with elevated blood pressure and a pattern in which their lipid levels were a little bit distorted in a way that could herald the later life consequences for cardiovascular health. So that prompted us to seek funding from the Centers for Disease Control and Prevention to look at two populations together. I mean, when you're talking 10 years out after the disaster and you haven't followed a population carefully every year or 2 years in the interceding period, you have the quandary that the more you go out, the more there can be other factors that might explain the associations that you might have been able to control for or rule out if you had followed the population more carefully over time. So we recruited a population of young adults and adolescents from the World Trade Center Health Registry, and we matched that population to a population of young adults and children who were New York City residents as well, but were not in the eligibility zone for the World Trade Center Health Registry. So they would be a reasonable comparison group for relatively less exposure. And I'll say more about why I mean relatively less as opposed to no exposure in a moment. We haven't published all the findings as yet. I'll give a preview to some extent of those findings, but I'll emphasize the findings we have so far. We performed a battery of tests over about 2 to 3 hours, looking at lung function as well as measures of blood pressure and stiffness of the arteries, both in the arms and also deeper in the arteries near the heart. And the good news is that we're not seeing as much of the differences in direct lung function that we saw when we looked at a similar population that was clinically referred. Now we are seeing a persistence in asthma, some 15 years out, at a higher rate in the exposed population and in relationship to the dust cloud exposure in children who are exposed in early life. But moving on to the heart health risks, what we've not seen are substantial differences in relationship to dust cloud exposure or even traumatic exposures to direct measures of heart health, that is, elevations in blood pressure or measurements of the stiffness of the arteries. So that, in a way, is a good news and reassuring for folks who are rightly concerned and maybe even scared about the implications in later life. Now, what we've also done is to try to get at the chemical exposures in greater detail. I mean, we're dealing with the reality that in some cases the recall of parents and children, even if it was based on the World Trade Center Health Registry, can be a difficulty, and insofar as you're imprecise about your exposure, it's harder to really identify effects that are really there. So what we've been able to do is actually leverage measurements of chemicals that were found in the dust, in the serum of these children. Two types of chemicals in particular, we're focusing on Teflon-like chemicals and dioxins. The chemicals that are emitted through burning of various materials that occurred in the months and years that followed. And we have found some striking differences in the Teflon-like chemicals. And when we look at the chemical exposure as the marker of exposure as opposed to the self-report description of exposure, we do start to see some associations, in particular with elevations in cholesterol and lipid levels, that may be a signal for future health risks down the line. So this reinforces both the need for ongoing medical monitoring and care, but also the need for further research to continue to follow up in this population. Now, I'll close by saying, going back to what Jackie described before having me come up, and that is that there were some early effects in prenatally exposed children, and to some extent, we've actually not heard much from that population. And so I have the privilege of working with partners at Columbia Mailman School of Public Health to leverage two existing cohorts where one was recruited for another reason, so didn't have as much substantial 9/11 exposure, and then a population that was specifically followed with the intent of getting a population of women and children who were exposed to get that kind of comparison. And that population is now about 15 years of age. So what we're doing is to not only leverage the existing data on their body mass and their growth, as well as measurements of their cognitive function, but also bringing them in to evaluate their heart health. And that may actually be where we find an even stronger signal, because prenatal and early life exposures may be a time window of even more unique vulnerability. So in that regard, I have to tell you, stay tuned, because we've just had the privilege of receiving the funding to get started with that work. So again, thank you for the opportunity. Would look forward to your questions and comments as the panel moves on. Thank you.